What is a fibrocyst? In women, one of the benign disorders of the breast is a hardness or mass in the patient's hand. As the disease progresses, breast pain and nipple discharge may occur. This benign ailment of the breast has been classified in detail in modern medicine. Among them, the most common benign ones are fibrocystic changes, fibroadenoma, intraductal papilloma, ductal ectasia, and mastitis. Although not a general rule, fibrocystic changes are more common in women of childbearing age. It is seen in almost 1 out of every 2 women. It can be noticed by increased breast density, palpable nodules up to the size of a hazelnut, pain and tenderness. Cysts swell before menstruation, and may be painful. The most important reason for these swellings is monthly hormonal changes, anemia, and fibrocysts. Iron-induced anemia is a very important disease. The trigger of many diseases is anemia. For example, allergic reactions, fibrocyst, a depressed life, heart palpitations, heart rhythm disorder, hair loss, rheumatic complaints, chronic fatigue, weakening of the immune system, thyroid complaints, hormone imbalance. Iron-induced anemia is effective in the formation and rapid development of fibrocysts. If you are suffering from anemia frequently or if you have chronic anemia, you should definitely be treated. First of all, have your body's iron storage checked and take care that your hemoglobin Hb value does not fall below 12. How to use broccoli cure against fibrocysts. Throw in about 200 to 250 grams of fresh and dark green broccoli into half a liter of boiling water. Cook for 6 minutes on low heat with the lid closed. After the 6th minute, take it off the stove and leave it open to cool. Drink half on an empty stomach 20 minutes before breakfast and the other half on an empty stomach 20 minutes before lunch. It should be prepared and drunk fresh every day for 21 days. There is no obligation to consume boiled broccoli in boiling water. It can be consumed if desired. The cure can be repeated from time to time depending on the situation. Note, if fibrocysts are present for more than 2 years, then the broccoli cure to be applied should be. It will be applied twice for 21 days, and at the end of each 21st day, there will be a 3-a-day break. A total of 40 days will be applied. It is not included in the 3-a-day interim application period, which will be given at the end of each 21 day. After this cure is completed, it is applied periodically 2 or 3 times a year depending on the condition of the complaint. Do not use broccoli obtained from hormone and transgenic seeds for this purpose. Make sure that the broccoli you buy is fresh and fresh. Do not buy yellowed broccoli. Attention! The use of broccoli cure against fibrocysts alone is not enough. While applying our cure, coffee, chocolate, walnuts fresh or dried, oranges, orange juice, and fresh white grapes should not be consumed. Don't forget to like the channel and subscribe.